Hi, I will be doing my report on alternative medication, specifically CBD and what it can do for you and how you can benefit from your life, and potentially what can be wrong with different medications that people typically take. CBD is the second most common ingredient found in marijuana. CBD oil can be found in most medical marijuana, however, it is taken from a hemp plant, which is actually the cousin of the marijuana plant. CBD doesn't necessarily get someone high like marijuana does, it more so relaxes and calms the body. There is no evidence of public-related problems associated with pure CBD. CBD can be purchased online in grocery stores and CBD-specific retailers. Consumer Reports conducted a survey, and they have found the most popular form of CBD was edibles that were infused with CBD. Vape pens, oil or drops, and rubs are also very common. CBD comes in doses of milligrams, and when you first start taking it, you should start out with a lower dose, such as 10 milligrams. Also, whenever you are purchasing CBD, you want to make sure the manufacturer has a certificate of analysis available. If a manufacturer does not have one or will not provide one to you, make sure you do not buy that specific product because that means it has not been analyzed to ensure that it is the safest form for you to consume. There are two receptors in the body known as CB1 and CB2 receptors. CB1 receptors are located in the brain, and it controls things such as your coordination, your mood, the way you think, your memory, and even your appetite. The CB2 receptors, however, are found in the immune system, so it will take care of the body's responses to pain and inflammation that happens in your body. CBD affects the CB2 receptor, which affect your immune system. So you'll find CBD oil to calm the body, to take away your pain, the inflammation, things of that nature, whereas the CB1 receptors will be affected by things like THC, which is found in marijuana. The CB1 receptors are located in the brain, as I said. Therefore, that's where you get your high from with the THC, because that is what directly affects it. So that is why you will feel high, get addicted to it, things of that, because of it being located in the brain and being directly affected by the brain. Oftentimes, when someone is prescribed medication for anxiety, they end up relying on that medication, and one of the negative effects of that is the terrible side effects that come with it. These side effects include upset stomach, confusion, muscle weakness, and sexual dysfunction. Symptoms like these are expected because of what they are used for. Anxiety medication is used for influencing the neurotransmitters' activity in the brain. And the neurotransmitters have multiple jobs, so when it's influenced by some sort of medication, it causes other symptoms in the body to occur. Whereas CBD oil have been found to maintain somebody's anxiety without the negative effects that come along with a typical anti-anxiety medication. With that, there are some minor side effects that come along with CBD, such as fatigue, dry mouth, drowsiness, and a few others. All medication is going to have side effects. It's just CBD oil has fewer negative side effects on the body. CBD oil can be used to calm and relax the body, which is what people with anxiety are going to need. People who suffer from epilepsy get seizures often, and they, of course, get prescribed medication to prevent seizures from happening. As all medications do, this comes with side effects. Epilepsy medication comes with quite a bit of side effects, such as sedation, slurring of speech, unsteadiness, prolonged fever, lack of appetite, and in some cases it can actually increase the amount of seizures one has. CBD oil has been found to decrease the amount of seizures one has without terrible side effects. A study was conducted where 30 clinical centers picked patients between the ages of 2 and 55 years old who had 2 or more seizures per week to receive cannabis with an oral solution. Out of 225 patients who participated in that trial, there were only 85 seizures between all the groups of people. That is an incredible outcome just from taking CBD. In this diagram, you can see how people who suffer from seizures benefit from CBD. 10 people in the study had an 80% decrease in seizures just from taking CBD. You can also see different side effects of it, such as their mood, alertness, and sleep increasing and becoming better just from taking CBD. Arthritis is a disease that refers to joint pain or joint disease, and there's over 100 different types of arthritis. More than 50 million adults and 300,000 children are affected by arthritis. They are given medication to relieve the pain of arthritis and the inflammation. However, you risk a heart attack or a stroke while taking that medication. Therapy can also be done to help the joints, but that is only a temporary relief. That is something that you have to continuously go to. However, CBD oil has been found to decrease the joint inflammation and serve as a protectant to the nerves. Anti-inflammatory medication is taken very often, and personally I feel like it's a little abused. People take things such as ibuprofen, Tylenol, Advil for headaches, sore muscles, backaches, inflamed joints, things of that nature. What people don't understand is how toxic it is for the body. The anti-inflammatory medications can cause heartburn, ringing in the ear, headaches, dizziness, liver or kidney problems, leg swelling, high blood pressure, need I go on. We can see here that it's not very good for your body to be consuming ibuprofen, Tylenol every single day. Now, if you're only using it here and there to help a headache, it's not going to do too much harm on your body. Whereas if you're taking 2 ibuprofen every single day to treat your headache you get every single day, it's not going to be good for your body in the long run. You may not notice you're going to have liver problems right away, but in 20 years, whenever you're having liver problems, it could potentially be because of how much ibuprofen you became basically addicted to. CBD, on the other hand, is a very good alternative to anti-inflammatory medications. There was a survey conducted that concluded that 22% of people who participated, and there were 4,000 Americans who participated, said they would replace their prescription medications with CBD. Some said they would even stop taking their opioids. Cannabis could be a tool in the fight against the ongoing opioid crisis, and I think it needs more attention than it is receiving. This chart is a survey of patients who frequently use prescription opioids. They tried cannabis for the survey, and instead of taking their opioid prescriptions, they would prefer to use cannabis. In conclusion, this means that cannabis has helped the patients with their quality of life, their social life, activities, and his or her concentration. As you can see, it is most of the things that they were focusing on during the survey had exceeded. It was a great benefit. There were a few that they had no benefit of, but I think the good outweighs the bad in this situation. This